Hi, I'm Dr. Trevor Williams, a thoracic surgeon at Mercy San Juan, and welcome to Tech Talk.
And I'm Michael Mair, nurse and lung nodule program manager.
Today we're exploring the lung cancer screening and incidental lung nodule programs and the in-house software behind them that are helping us catch lung cancer earlier and follow patients more consistently.
Let's start with the clinical challenge these lung nodule programs were built to address. So a lung nodule is a small spot on your lung that may be seen on an imaging test like a CT scan. In most cases, lung nodules are a normal occurrence, but in some cases they may turn out to be an early lung cancer. This is why it's important to track and follow lung nodules. There's a problem with people who have incidentally found lung nodules, or these are lung nodules that are found by accident. So we know maybe 30% of lung nodules that are found incidentally are tracked. So that means like 70% of lung nodules are not followed correctly.
So the lung nodule program allows us to take some of the burden off of all of the things that are going on for the patient with their visit.
Our lung nodule program is two arms to it. There's the incidental lung nodule arm, and then there's the screening arm. So the incidental lung nodule program works using our software, which uses a form of AI to pick up on the radiology reports where there's mention of a lung nodule. For example, a patient comes in through the ER, and unfortunately they've had a fall off a ladder, and they get a CT scan of their chest in the hospital. They've lots of other concerns, but either way, the software will pick up from the radiology report and coordinate with the primary care doctor and the patient to make sure that they get the correct follow-up. The other arm of the program is lung cancer screening, and those are patients who've been referred by their primary care doctor usually to have a low-dose CT scan of their chest if they've been a smoker in the past or a current smoker. Other hospitals may not have what we have, a solution like this to identify lung nodules at an early stage and to ultimately detect lung cancer at an earlier stage. So we're very fortunate.
And the results from this workflow speak for themselves. This process has already made a measurable difference in what stage we're finding cancers. If you detect a lung nodule when it's small, if you detect a lung cancer when it's early, the treatment and the possibility of cure is significantly higher. We've seen lung nodules detected with the incidental program that have gone on to surgery and had early stage 1 lung cancer cured. The last year of lung nodule tracking and detection and workup has found and treated about 10 lung cancers. Behind these results is a coordinated team using the system every day. These outcomes are possible because of how our navigators, clinicians, and tumor board use the program.
So there's two nurses and then our medical director, Dr. Williams. And then on a broader scale, we have the primary care doctors who are involved in tracking lung nodules. We can look back in time for patients through all our health systems in Sacramento to see where they've had previous scans, and we can have them compared with current scans if they're available, and these patients can be reviewed on the weekly tumor board, thoracic cancer conference we call it, and the expert panel will make recommendations for that patient.
We're going to be able to potentially have the whole system under an umbrella of lung nodule detection so that anybody who gets a scan and a lung nodule is found is going to be tracked.
Thanks for joining us for this Tech Talk on the lung nodule program and the software that supports it.
We'll see you next time as we continue exploring the technologies shaping the future of patient care.